Good morning. How are you? Did you have a nice holiday? A nice break with your family? That's nice. I'm glad. Let me go ahead and get my gloves on, okay? So that we can get started. I'm so glad it's been raining lately. You know how it is, we almost never get any rain here. So when it finally rains, it's really exciting. At least in my opinion. And it's been raining pretty hard out there today. Have you been managing to keep dry? I'm glad. Okay. So you're just here for a basic checkup, right? Great. Okay. Okay. So today we're just going to go through some basic things. We're going to look at your eyes really quickly, your ears, your nose, your sense of taste, skin, if you have any concerns there, and anything that comes up, I'm going to go ahead and take some notes on that, okay? Okay, good. Actually, just starting with sense of taste really quick, we're not going to be running a comprehensive exam on your sense of taste this morning. I'm only going to go ahead and refer you to a specialist if you do know that you have any problems with that, but if not, we're just going to go ahead and skip that part for today. So, just off the top of your head, have you been noticing any problems with your sense of taste, swallowing, anything like that? No? Okay, good. So that will conclude that part of the exam today. Again, if you do notice anything in the next couple of weeks or whatever until your next appointment, definitely come in early. Let us know. We don't want you to have any issues with that. So definitely let me know if you experience any problems. But otherwise, we're going to go ahead and leave that at that. But okay, great. Let's go ahead and start with your eyes. Okay, so before we get started, have you noticed any issues with your vision? Any changes in vision? Any itchiness, dryness, any problems seeing, any difficulty when you're driving, anything like that at all? You're noticing you have a little bit of a hard time seeing far away. Okay, let me make a note of that. Possible change in distance vision. Okay. So I'm just going to take a quick look at your eyes externally. What we're going to go ahead and do is I'm going to refer you to an eye doctor so that they can take a look at your vision and maybe give you some glasses if you need that, okay? Okay, good. So let's go ahead and get started. Okay. I'm just looking at how your pupils react to the light, okay? I'm sorry if this is a little bit uncomfortable. Now from the bottom, this side. Okay. Just blink a couple times. Blink, blink, blink. Okay, good. Let me just apply some pressure here. Do you have any pain here? Here? Just around your eyes here, no pain? Good. Okay, do you notice your eyes are tearing up a little bit more in any time or anything like that? No? Okay, good. So you've only noticed a possible change in your vision then. Okay. So I didn't notice any external issues with your eyes. I don't notice any redness, swelling. I didn't notice any problems with the lights, no issues with the reactiveness of your pupils. So possibly you might need glasses, which is totally fine. I wear glasses and I'm okay, so you'll be okay too. And then we'll go from there. Actually, before I forget, let me just go ahead and test your color vision, okay? Okay, so I've got a couple of different colors here. Let me scoot you farther back a little bit. Okay, what color is this? Okay, this one. This one. This one. This one. This one. Okay, good. Let me write that down. So you did completely fine there. No issues with your vision in terms of color vision. Good. So yeah, I'll just refer you to the eye doctor in case you need glasses, but other than that, you're looking perfectly fine to me. So let's go ahead and do your ears. Let me do a quick visual inspection here, if you don't mind. Other side. Any pain, any sensitivity? No? Okay, let me take a look. Let me just put you like this. Is that okay? Okay, good. Let me take a look here, just with the light. Look inside. Okay, it doesn't appear to be any ear infection or anything like that. Other side. Looks good. Let me just take a look at the skin there. Okay, good. So close your eyes, please. Okay, can you hear this? Okay. Can you hear this? Good. How about this? How about here? Okay, now tell me left, right, or both. Good. 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 Okay, now tell me which side sounds farther, left or right? Again? How about now? About the same. Okay, good. And you haven't noticed any increased ringing in your ears or difficulty hearing or anything like that? Okay, good. So I'm not noticing any serious or any issues at all with your ears. In terms of the physical external factor, they look fine. No dry skin, no excessive wax, no issues there. And if you're not reporting any issues with your ears, we don't really have a reason to extend this exam into any more more comprehensive tests. We would only get into something like that if you start noticing problems with your hearing. But okay, now let's look at the nose, please. Let me bring you a little closer here. let's look at the nose. Okay, do you have any sensitivity here? No? Okay, good. And have you noticed a change in your sense of smell or anything like that? Okay, good. Let me go ahead and take a look with the light. Okay, looks good. Let me just go ahead and do a little sense of smell taste. So, okay. What does this smell like? Lemons. Okay, good. And this one. Apples. Okay, good. So, I'm not noticing any sense of any issues there. Again, I would say if you're noticing a change there, you would probably also be noticing a sense of issues with your taste. But if you're not having any problems there, I think you'll be okay. I did want to go ahead and just feel around on your skin, at your fur, and make sure you don't have any problems there with any itching, dryness, anything like that. So before I start, I just wanted to ask, have you been noticing any problems there? No? Well, that's good. So this should be fairly quick. Let's go ahead and get started. So on your face, no sensitivity here, right? Ears we did, so scalp. Let me go ahead and check here. We don't want any lice or anything like that, so let me just go ahead and give it a quick little look-see here. I'm not seeing anything. You take very good care of your mane, I'm glad. Okay, this paw, no issues here, no sensitivity. Good. Excuse me. Here. No? Okay, good. Any issues here on the stomach? No? This leg, no? Tail? If I apply pressure on your sides here, does that hurt? No? Okay, any sensitivity on the skin here? No? Okay, good. Let me go ahead and just give you a quick little once over here. Sorry if you can hear the cars driving by outside in the rain. I like that sound. I think it's kind of relaxing, but yeah, in case you're hearing some sort of repetitive noise, it's the cars. Stomach, excuse me. Okay, good. Now I just want to do some quick little measurements just to check that everything looks as expected there. Okay. Other side. Okay, tail. Okay, from ear to ear. Okay. The nose. Distance between eyes. Okay. Then, excuse me, down here. Okay. So, skin looks good. I noticed no issues, and you also didn't have any complaints. In terms of notes, your measurements look good. And I didn't have any concerns. You look perfectly fine to me. I'm glad to hear you're not having any new issues or anything since your last appointment. You did great during this exam. Again, the only thing you noted was the possible change in your distance vision. Again, I'm going to refer you to the eye doctor. I'm going to give you a referral to the eye doctor. But again, just to review, your eyes were fine. Besides the vision issue, ears, nose, taste, skin, all that was fine. So thank you very much for coming in. It was nice to see you again. And yeah, definitely come in sooner if you notice any issues. Thank you. Okay, welcome in, welcome in. How are you? Are you new to our clinic? Okay, well, it's nice to meet you. I'm going to be your doctor today. This will be a really quick little exam, okay? Nice to meet you. This is not going to take that long. Don't worry. I know going to the doctor can be a little bit nerve-wracking. Unless you're going to report any concerns or anything, I'm not going to refer you to any specialists or anything like that unless that's what you need. Specifically your sense of taste. We're not going to be doing a comprehensive exam for that today. Only if you report having any issues am I going to refer you to a specialist. Otherwise, we're going to assume that everything is operating as normal there. But in fact, if you could just, I'm going to get a little closer, okay? If you could just open your mouth really quick. Say ah. You say you have some pain right here on this side of your jaw? Right here when I press? Is it dull or sharp or... Open again, please. I see. Okay. Well, I'm not seeing anything visual. This is going to be something that I would recommend that you ask a dentist about. It might have something to do with how your bite is. You might be grinding your teeth when you sleep, or you might be applying too much pressure on this side when you chew. But that's something that a dentist or possibly if they need to refer you to a specialist, they'll know who to go to from there. But I will say I'm not seeing any immediate concerns. I'm not noticing any severe issues with your teeth or anything. I don't notice any severe issues with your jaw or the outside of your jaw here. So most likely it might just be a problem with your bite or maybe a small cavity or something. But again, as far as that goes, I would definitely advise you to check with your dentist, okay? Okay, great. But in terms of taste, no issues? Okay, good. Let me write that down. And we'll go ahead and get started, okay? I'm going to make a note of your jaw pain here. Just so we can keep a good record of everything you brought up during this exam. But again, that would really be something for a dentist to check out. But okay, do you have a preference on anything in terms of getting started? Any complaints you might already have that you know you want to get looked into? You have some pain in this foot. Okay, why don't we start there? Do you have pain anywhere else besides that foot? Okay, good. So I'm just gonna feel around here. Please let me know if you experience any pain or discomfort anywhere. Okay, so let me check everywhere that's not the area of concern just to make sure that we don't notice anything else. Okay, so now I'm going to move on to the problem area. Do you have pain in the leg? If I apply pressure here, do you notice any pain or sensitivity? No? Okay, good. So tell me as I'm going down where the pain starts. Here? So it's maybe in the toes perhaps. Okay, let me go ahead and see if I can see something. Did you have any injuries recently, or not even recently, really? I mean, have you ever injured this foot? A year ago. Okay. Did you come to the doctor for that? And has this been hurting since then, or is it sort of flaring up again? I see. So, externally, the skin looks fine. It doesn't appear to be anything sort of external. We're definitely going to do some x-rays though for your right foot. I'm just making a note here. And it's a dull pain. Okay, scale of 1 to 10. 7. Okay. I might give you some pain medication for that. Just so that, I'm really anticipating that we're going to see something on the x-rays. Obviously, that's not going to be something we're going to be able to fix immediately, but I will give you some pain medication so that while you're waiting for us to kind of come up with a more permanent solution to that issue, you can go ahead and take that pain medication, okay? But the nurse will come in with your notes when we're done with your appointment, and she'll let you know what you can do about the medication, okay? But yeah, don't worry, we're gonna get that all sorted once we see the x-rays. I'm sure we'll know exactly what's going on and how to fix it, okay? Okay, good. So let's go over to the eyes, okay? Have you noticed any changes in your vision, or do you have any concerns there, or anything at all? No? Okay, good. So let's go ahead and get started. Okay, so I have some colors here. I just want you to go ahead and say what color it is, okay? So, what color is this? Okay, this, this, this one, this one. Okay, good. Okay, now, do you have any sensitivity when I press around your eyes like this? On your skin, or maybe somewhere deeper? Do you notice any pain? Do you get, no discomfort? Good. And do you get any headaches or anything like that? Not really. Good. That's good. I know this can be a little uncomfortable, but it's very important. Okay. so I'm not noticing anything there. Normal reactivity. That's what we like to see. Good. Okay, moving on to your ears before I get started. Have you been noticing any changes in your hearing? Any ringing noises? Any persistent sounds that won't go away? Any ear pain? No? Okay, good. Let me just take a quick peek. I'm going to apply some pressure. Does this hurt at all? No? Good. Let me take a look at the back here. The insides here. Let me go ahead and get the light. Looks good. Okay. So no issues. Good. So now I'm just going to go ahead and check your sense of smell very briefly. This is similar to the taste where I have no reason to assume that there's anything wrong with your sense of smell. No. Unless you report something, we're not going to look into this too deeply because there's no cause for concern. But let me just go ahead and take a look at the external factors here. Any pain here? Okay, good. Okay. Okay, and what does this smell like? Citrusy. Good. And this one? Good. Those are correct. That's what we were hoping you would say. Okay. So I'm not noticing any issues there. Again, if anything changes over the next 6 months, or what I mean is before your next appointment, definitely come back in and I'm going to refer you to someone who can give you a more comprehensive exam there, okay? Okay, good. Okay, so moving on to the last thing here, I'm just going to check your skin and take some measurements, okay? All right, so let's go ahead and check your scalp, please. You take very nice care of your fur, I'm glad. No pain, no sensitivity. Yeah, if you feel any pain or sensitivity anywhere, please report it. Don't feel bad, don't feel embarrassed. Even if you think it's not a big deal or maybe not so bad, please definitely report it, okay? Any pain back here on your hind legs, your side, arms when I apply pressure right here on your neck, hands, arms, on your back. Let's just feel your spine here. Tail. No? Even a little? Good. Let me go ahead and just check with the light, okay? We don't want to miss anything. I want you to leave here feeling completely confident that all your health is in order, and I want you to feel like I've addressed any concerns you might have, okay? Because I think it's really important to feel safe and to feel like you're okay. Just feeling for any bumps or anything that stands out in your fur that maybe shouldn't be there, okay? In the front here, arms. Okay, please lay on your side. Other side. Good. Nice. Okay, let's do some measurements and then we're done. Lay on your side, please. Okay. Length. Head to tail. Let's do just the tail. Okay. Here. Distance here. Distance there. Here. Okay, good. Everything looks exactly as I would expect, relatively symmetrical. Of course, no one is completely symmetrical, and that's normal. Okay. Okay, so I'm happy to report that this exam has come to a conclusion. Everything looks good except for that situation you mentioned with your jaw on this side here. Again, I think a dentist will sort you out. And besides this paw here, which we actually can do x-rays here in-house. So I'm going to send you to go get one. And then I'm going to review the x-rays. And you should expect a call in a few days from me letting you know what the next steps are going to be, okay? Okay. Oh my gosh, I forgot to put your name at the top of your chart. How did that happen? Okay, great. All right, do you have any questions for me? No? Okay, good. All right, so the nurse is going to be in a second, okay? Okay, thank you. Okay, good morning. It's nice to meet you. Okay, and what are you in for today? I think I checked your chart and you're not in for a general a physical exam, right? So what seems to be the problem today? Okay, I'm going to go ahead and take some notes, okay? Because we're going to go ahead and get started now, but you're reporting pain in your eye, okay? Okay, and which eye is it? This one or that one? This one. Pain in left eye. Okay, and do you find that your eye is tearing up a lot? Okay, excessive tears, okay. And is it a dull pain or a sharp pain? Okay, scale of 1 to 10, but constant, okay. Okay, and when did this start? 3 days ago. Okay. Okay. And the other eye is completely fine. This eye is completely fine. Okay, good. And any other issues anywhere, or are you just here for this eye? Just this eye? Okay, good. Well, I'm sorry to hear you've been having this issue. Has this happened to you before? Yes, okay. And that time? Okay, eye infection. Okay. Well, bad news is it always is unfortunate when we're having any pain. But the good news is if you were able to get it cleared up last time without any issues, I can sincerely hope that this time will be the same. Okay. Anything else you wanted to report? Okay. So, let me go ahead and take a look, okay? I'm going to lay you on your side. Is that okay? Okay. Good. Let me just And I'm gonna move your ear out of the way, okay? Thank you. Okay, so let me just go ahead and take a look visually just with my eyes here. So I do see what you're saying. I do see the excessive tear production here on this eye. I'm gonna try to be gentle here. Do you have any pain or sensitivity when I press around the eye? Some itchiness. Okay, so some itchiness around here. Okay. Let me see. And you said it's been 3 days-ish? Okay, I'm just gonna go ahead and take a look with the light. Okay, I'm sorry if this is adding to the discomfort, but I just need to get a better look. Okay. Okay. Is your vision blurry right now? Can you focus on this blue pencil? Please continue to focus on it. Follow it wherever it goes. Don't move your head, please. Do you find that you're having a hard time doing this, or does it seem okay? Maybe a little discomfort, a little pain? Okay, please tell me when the blue pencil leaves your field of vision, okay? Okay. Okay, I'm gonna pop your ear back down here and sit you back up. Just a little bit of an infection here. It's not too serious. I would say mild, which is a good thing. I'm gonna give you some antibiotics, okay? You need to take it for 5 days. The instructions are going to be on the label, and the nurse is going to explain it to you, but just really quickly, it's going to be 1 tablet in the morning with food and 1 tablet at night with food, okay? And it's 5 days. And then this should pretty much clear up. You should notice it getting better day after day after day, but by the end of the antibiotics, it should be gone or close to gone. If it gets any worse, or if you notice any other symptoms, please come back in so we can take a look. But I really don't think that's going to happen. I think you'll be okay. And then, yeah, if it's not gone after the 5 days also, or let's say 6 days, it can take maybe 1 extra day. But if it's not gone basically in a week, please come back in. The nurse is going to come inside and just check you out, and then you're going to go to the pharmacy and get those antibiotics, okay? But it was really lovely to see you, and I really hope that this clears up as soon as possible so your discomfort can be over with. But thank you for coming in, and have a nice rest of your day. Bye-bye.